I say to other people going through this, surgery is not the only answer to your problem. You have to go through this rehabilitation process if you really want to get back to whatever you consider your normal life. But even if that means, you're somebody who just likes walking, right? You don't necessarily have to be someone who goes to the gym or run or be super active, but just being able to perform everyday tasks normally, pain-free, you still need to have this structure in place for yourself.
Welcome to season 2 of Bed, Back, and Beyond. I'm so excited to start this season with this guest story. I am joined by Chisel and Strides Saloni. Saloni is calling me from Dubai, and she is a fellow microdiscectomy patient, but her level of care will make many of us jealous. And I just love the wisdom that she brings from her Pilates instruction. Hi, Saloni. Thank you so much for joining me on this episode of Bed, Back, and Beyond. Before we dive into your injury, how about you tell us a little bit about yourself?
I grew up in Kenya. I used to be a competitive tennis player. So I played for Kenya from about almost 6 to the age of 18. And then I went to Cornell for my undergrad and I played college tennis for Cornell. And then I went on to become a lawyer. And then I did that for many, many, many years. And then finally, I sort of came back to my original passion, which was to teach fitness classes to people, but I opened up my own studio. So that's what I do now. And I've opened up 2 studios and I offer an assortment of classes, but my real passion is teaching Pilates classes because I firmly, firmly believe in the power of Pilates, particularly in relation to all matters related to back pain, which is something I'd really love to share with your listeners today.
And where are you located now?
I'm in Dubai now. So I grew up in Kenya. I've lived in the US for a little bit. I've lived in Australia for a long time. And I have lived in Dubai for over 12 years now.
I'm very boring compared to you. I've always lived in the US and I only switched states, and the one state was only 45 minutes away from Pennsylvania to Delaware. And now I'm back in Pennsylvania again.
You must travel. It's fun. It's really, really fun.
I'm heading to Canada in June. So that's a big trip for me.
That's an international trip. So there you go.
Yes. Yes. Awesome. So then when did you get hit with an injury, or did you always have back problems?
So as I was saying to you, I played tennis competitively for a long time, but round about 2000, these back pains started to increase in frequency. And then I got a scan done, and they could see that there's a little bit of facet joint arthritis starting to creep up in some of the discs. Usual ones, suspects are sort of L4, L5. But one of the sports medicine doctors who I was seeing in Australia recommended that I get on and do Pilates. So that was a form of like rehabilitation for me. Initially, because I was so used to working out in a slightly more active or ferocious way, I did not like Pilates. I didn't relate to it as not my way of exercising. So what I used to do, I used to think, right, this is just a form of physiotherapy for like 1 hour. You just got to get on with it because it's going to make you better. But as time went on, I realized that it was managing the pain a little bit better. And I sort of started to develop not so much a liking, but a respect for what it was doing for me. And so I think, I've had back pain for over 20 years now. I still have it. I still have flare-ups, but I've always used Pilates as a form of rehabilitation, if you want to call it that, for the spine. So short answer is 2000, that's when the back pain started.
Okay. And then did you at one point have a herniated disc event?
I did. So 2021 COVID hit, and I started to feel a little bit more numbness travel down my right leg. And then it was just a build up and a build up and a build up. And then like shooting pain would start. And I was like, this is new. I haven't felt this before at all. Right. The only problem was it was COVID. And so, even getting access to be able to see a doctor or to get an MRI done was pretty difficult.
Mhm. And I'm sorry, where were
Fortunately,
you at this point?
in Dubai.
You went in Dubai. Okay.
Yeah. Fortunately, things here had, by the time I had these symptoms, that opened up a little bit more. So I did manage to get an MRI. And the minute I got that MRI, it was pretty obvious that my L4, L5 disc had herniated. It's sitting right on top of the nerve, which explained the radiating pain down my leg. But it got extremely intense. Like just being able to walk, 10, 15 meters was just excruciating without sort of stopping and taking a break. So I spoke to a neurospinal surgeon back in Australia and said to him, "What do you think?" Because the last thing I wanted to do was honestly surgery. I was willing to comply with any physiotherapy's orders. I really wanted to try avoid surgery at all costs. But after he assessed it, he goes, "You need to go for surgery immediately." And I wanted to head back to Australia because that's where my physiotherapist, who's well acquainted with my spine, was based. And he said to me, "There's no chance with what's happening with COVID and Australia being an absolute lockdown that you're going to be able to get here."
That's right. I forgot how extreme Australia was
Yeah.
with lockdown, yeah.
So I knew that it wasn't just about getting the surgery, it was about having a rehabilitation specialist to deal with me post surgery. And I wanted to go back to my old physiotherapist who, I'd been dealing with for many, many years before I moved over to Dubai. But given what he said, I had to look for a team here in Dubai. And I sort of went surgeon hunting, if you want to call it that, and wanted to make sure that whichever team I selected for my surgery had a comprehensive unit put together, which is surgery and then a separate team dealing with post surgical rehabilitation on the spine. And fortunately, is one here from South Korea. And so I went to see that team and the neurospinal surgeon. And he is a man of very few words, but in a good way, because he just affirmed what the neurospinal surgeon in Sydney said to me, which is you need surgery and you need to get it done soon because otherwise you're going to have more nerve damage and you're an active person. So the last thing we want is that we finish the surgery and then you've got such extensive nerve damage that the rehabilitation will take longer than it normally takes. But I think after meeting him, I was sure that I'd be able to have sort of both ends of the stick, which is not only surgery, but the post rehabilitation by physiotherapists who are used to dealing with surgical patients. So not all physiotherapists can deal with that scenario, right?
And
But
they were
his
part of that same doctor's practice?
yes, they work hand in hand, right?
That's great,
And I
because you
think
don't get that in
yeah,
the US.
no. So I think that's really unique about what I got here, and which is something that whenever somebody now is saying to me, "Where should I get my surgery done?" I would always say to them, "There's two sides to this. There's the neurospinal surgeon, and then who's going to look after you after that? Who's in charge of you after that?" And I don't think every physiotherapist is capable of trying to take care of surgical patients, right? They might be well versed with back pain patients, but not back pain patients who have had surgery. That's a slightly different kettle of fish. So I managed to get in for surgery in October 2021. And then that surgeon was somebody who I think because he understood my mindset, which is she needs to get back on her feet because she's an active person. I specifically recall post surgery asking for a walker because I was like, I can't even stand up straight. And I said, "Please, can I go take a walker to go home?" And he goes, "No." I'm like, "What do you mean, no?" And he goes, "No, you're going to learn how to, walk gradually, supporting yourself." But, I think they were just mentally training me, going, "Start, right? The rehabilitation process now. We're not going to baby you. You're going to have to sort of push a little bit harder and work with our team." But yeah, I think I just got lucky, to be honest with you, because I know not everybody has that opportunity.
Right. What's the healthcare situation like in Dubai? Is it private or is it,
Private,
universal? It is
private.
private,
Yeah,
okay.
it's expensive. Like if I didn't have insurance, right, this would probably rob me of my savings for a big chunk of my savings. So This is easier said than done, but just don't try to get into this situation so you don't have to incur this much money, right,
If you're
to
listening,
fix
don't
yourself.
herniate your disc.
Yeah.
Oh. So how long was it in between herniating your disc and then getting the surgery in October?
I would say I probably waited about 3 months, which is not too bad,
No,
because the
in the moment,
instruction
it
from
feels like forever.
Yeah, yeah. The neurospinal surgeon, he had said to me ASAP, and the closest date I could get was October. But then, again, it was just like, I'm gonna need this support system post-surgery, right? So, I was hoping my mom could fly in from Kenya and just help me out a little bit in the days after, just simple things, right? Like just being able to put your clothes back on after a shower or, just being able to make some food because these are really basic chores, but you're not able to do them yourself. So I think I sort of set everything up in such a way that post surgery, I'd got this team to deal with my rehab, and then I'd got my family and just gone, right, you're going to have to just focus and get through this over the next few weeks, but you need people around you to be able to help you.
So how long after so the surgery went without a hitch, right? Pretty good surgery?
Surgery, yeah, so mine was a little bit more complicated, again, because of my extensive back history. So I did only had a microdiscectomy. I had a laminectomy, which means they essentially shaved through the bone a little bit more on the disc above to be able to create more space for that nerve root to go through. And that was necessary for me. So I'd spoken to my surgeon going, this other procedure, we need to knock it out and finish it up at the same time, right? Because I don't want to have this twice. So the surgery is a little bit longer, it's about 4.5 hours. It didn't mean that the rehab plan was going to change, but yes, I got it in October, and then I spent one night in hospital for them to monitor me, and then I was discharged the next day.
And then how soon after your discharge did the physio, aftercare team step in?
Again, all credit to this team in hindsight because they were really, really organized, right? And it was surgery date is here, and then they locked in all my physio appointments, right, over 12 weeks. So it's like I had a 3-month game plan as to what was going to happen in terms of the rehabilitation. The neurospinal surgeon just gave me like really specific instructions. So, number one, here's your back brace. You were always to wear your back brace, always, right? For the first 6 weeks. No bending, no twisting, no rotating, right? So, again, that was another rule of thumb. So, that's rule number two. Rule number three was walk as much as you can, right? Avoid sitting so much. You either lie down or you walk, but really try avoid sitting. So those are sort of the three rules I was given to deal with. And then the rehab team, in the meantime, were like, they treated me to try and get the inflammation down within the surgical area. So I've gone to plenty of physiotherapists in my life. I hadn't seen a treatment room like this before at all. And you could see that it was just specially designed to deal with surgical patients, right? And, the plan in the first few weeks was absolutely no sorts of crazy exercises. We just need to get the inflammation down within the muscle. And that was sort of the first month. And then slowly, because they knew I was an athlete and, I'd done Pilates for a long, long, long time, it was introducing some of these basic movements back in to try stabilize the spine again and the surrounding muscles. So I feel in hindsight like it was quite structured and that really helped. And the only thing, that I had to watch out for was sort of not to get up like a horse and start running. Like I really had to restrain myself and go, just respect the process and don't rush in because you're dealing with the spine. It's gone under a lot of trauma. So just learn to listen to your body.
Do you feel like having that physio team in place was also a good emotional support for you?
Absolutely. Because I would never have even undergone this surgery without having that in place. So I interviewed another surgeon and I go, what next? And he didn't really have a response. And I'm like, well, then you're not my surgeon, right? So there was this, sort of two-step process for me, which is the surgery has to go fine and then we can move on to the next step. So I think, like I say to other people going through this, surgery is not the only answer to your problem. You have to go through this rehabilitation process if you really want to get back to whatever you consider your normal life. But even if that means, you're somebody who just likes walking, right? You don't necessarily have to be somebody who goes to the gym or run or be super active, but just being able to perform everyday tasks normally, pain free, you still need to have this structure in place for yourself.
Yeah. Here in the US, what seems to be very common is that the surgeon says, "No BLTs, have a good rest of your life."
Correct.
And then some will recommend physical therapy or physio, but others will say, "Absolutely not."
Yeah.
But still just send you on your merry way.
Yeah.
And
I
a
think
lot of patients are left to deal with the emotional side and the physical flares kinda on their own.
so. I do get that sense. There is a Facebook support group, I'm going to call it that, called the Microdiscectomy group. And oftentimes people will have these questions, right? And I'll always respond the same way to them, which is, okay, your surgeon said this, but who's taking care of you after? And the more responses I'm seeing, I do unfortunately get the impression that the medical system there is fractured, and it doesn't seem to have a comprehensive overview of how to deal with back pain surgical patients, if you want to call them that, right? And so it doesn't come to much surprise then that people are complaining like 2 years later, I re-herniated. Yeah, but the answer to that is pretty simple, which is if you didn't strengthen your spine again, your spine is already vulnerable. It's gone through a lot of trauma, right? And if you go back to the body's basic objective, which is to try and protect your brain and your spinal cord, if it senses any danger to the spine, it just locks it up and it stiffens it up because that's what it's meant to do. So I think there needs to be a little bit better preparation for people going through the surgery. And I think you can distinguish good doctors from bad doctors. Like I've referred a few people onto my surgeon, and he goes to them, "You don't need surgery." And then they'll come back at me annoyed, going, "You told me he was good." I'm like, "He is good because he's telling you you don't need surgery. It's a really good sign, right? Why are you getting annoyed about it? Like, you need to go through conservative treatment, and that requires work. You have to put in the work. Nobody else can put the work in for you." But I think a lot of people, again, that's where the problem arises because they seem to think surgery is like this magic wand which will fix all of the issues with the spine, and it doesn't, right? I'm grateful to my surgeon for being very candid with me to say, Saloni, you've had an extensive history of back pain over 20 years, and I'm not here to fix your back pain. I'm here to fix your nerve pain, right? And that I will fix, and you will no longer feel the shooting pain going down your leg. But you will face flare ups from time to time. And I do, despite how active I am and how conscious I am, it comes and goes. But, I've learned to sort of manage the situation and listen to my body.
Yeah. When people say, "My surgeon said I'll wake up pain-free," I'm always like, "No," like, you
Yeah.
shouldn't go into surgery with that expectation
No, no,
because
no, no, no.
it just
No.
adds to the emotional defeatism if you still are
Correct.
in pain. Yeah,
Correct. Correct.
yeah.
I
You're
think
gonna
it
have an
gives you relief.
influx of people, I think, coming to Dubai for medical treatment.
I think I need to ask my commission from the surgeon
Yeah.
if he's gonna get this many patients. But to be frank, he's so booked out. He just like they're very, very good at what they do. But speaking to his team, I got to know his team quite well, and particularly the physiotherapist team. And they go, "You are such a diamond in a haystack because you just follow what we're telling you to do, and that's why you're making quick recovery." He says most people just don't do the rehab we're asking them to do, and then they keep complaining that everything's resurfaced all over again, right? And that's what I keep impressing upon people, which is if you don't put in the work, then don't blame anybody else because you really, really have to be disciplined in terms of the rehab to get your spine back to some normalcy post surgery.
And are you back to playing tennis now?
Yeah, I am.
Oh,
So
great.
I the thing I wanted to do, which I was missing most, and which I had been told to avoid pre-surgery, was running. So when I finished sort of my 6 months post rehab, I started almost testing my back, going, let's see the level of impact it could have. And the way I train myself is I would, let's say, run 500 meters and walk 500 meters. And I'd do that like for 3 kilometers and see how the back was behaving. And then 2 or 3 months later, I'm like, hey, let's see if my tolerance has gone up a little bit more, right? So can I run a kilometer, take a little bit of a break, run another kilometer, take a little bit of a break, run another kilometer? And then that seemed to be okay. And then I moved to like 2 kilometers and 1 kilometer. And I sort of just kept playing around because these things are not going to happen overnight. You still got to put in a lot of strength training and work into building your core strength and spinal strength again to support activities like running or to be able to play rotational sports like tennis. But, I'm just over 3 years out now. And last October, I ran a straight 5K without stopping and without any pain. So that was, for me, that was really good because I'm like, great, like the spine's able to withstand this level of impact over a prolonged period of time. That's not to say I don't have my bad days. I do. And
Meaning you still get flares?
yes, I do. I had a bad flare up in November. But what I'd say is that I think I've just learnt to manage the flares by myself. I have a physio, she's excellent. But I think once you get a little bit more in tune with your body, you can sort of start to understand the severity of the flare and where the flare could be originating from to be able to then address it, right? Not just with anti inflammatories or muscle relaxants or ice, the usual things, but actually with exercises. So I go to my physiotherapist when basically everything I've tried on my own is exhausted and I can't really do anything else. So she uses a little bit of I'm going to say Middle Eastern and Chinese techniques. So cupping, needling, little bit of electric therapy with the TENS machine, manual treatment as well. And sometimes I need a little bit of that invasiveness just to get the spine to calm down. But the new thing I've discovered is cold baths.
Oh,
And
okay. Are you up to
yeah,
11 minutes yet?
no, 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 no. But this was a new discovery for me. So one of my clients at my studio said to me, try this cold bath. And it fortunately in Dubai is so hot that actually anything with a low temperature is going to do at that point. So I did it last July when it was very hot here. And I just felt like this immediate, like, is like somebody put lotion on my spine. And it was just so calm for a day. It felt so good. And then I did it day before yesterday, and I got the same feeling from it, which is just this sense of calmness in my nervous system. So there is something to be said for cold baths for people suffering from flare-ups.
I haven't done any cupping or acupuncture, but mainly because I have a girlfriend who does it professionally, Kara, in California, and I'm in Pennsylvania, so I feel like I would be betraying her if she's not the one doing my treatment.
Well, if you go to California, you got to
Yeah,
try it.
yeah. She's
It
done
does,
cupping on me before,
yeah.
but I
It
haven't
does
tried
work.
cold baths either.
No, that's a new one for me. I'm still trying to get used to it, but it
Yeah,
does work. What I'd say to you is, I
yeah.
do find it quite beneficial.
I've certainly have watched some, documentaries and YouTube videos about people doing it. There's a man, I can't remember his name, who really pushes for cold baths.
I know who you're talking about.
So how important of a role has Pilates had in your recovery?
Massive. So, as I mentioned to you, I own a fitness studio. I teach Pilates classes. And a lot of clients, I think, just because of the nature of their corporate jobs, involves a lot of sitting and they'll, consistently complain about back pain and neck pain and so on. So, the way I view Pilates is this, which is I think about it as your spine running from all the way from your neck to your tailbone and any muscles which effectively surround your spine is what I need to address when I'm teaching Pilates. So I have two elements to it, which is the mobilization of your spine from the neck to the middle of your back, your thoracic spine to your lumbar spine. And then I focus on strengthening all those muscles wrapping around the spine. And I think having, done it now for 20 years, where I started off, almost going, why am I doing this? But knowing that this was doing some good to it, to now fully respecting it and actually enjoying teaching it to others. I would say to anybody, right? You've got back pain and your doctor's advice is don't go for surgery and try conservative treatment. Engage a Pilates instructor, a really good one to help you, right? If you're not somebody, the physiotherapist can provide basic guidance on exercises to do, but if you feel like you're the kind of person who just struggles to exercise themselves, you feel like you need a bit more accountability, I would engage a Pilates instructor on a one-to-one basis. I wouldn't go into a class because maybe they don't understand your spine completely, and a group setting's a little bit different. So I do one-to-one classes if you have the means to be able to afford it, right? Otherwise, if you don't, just enter a group class and obviously just inform your instructor beforehand about any issues you may have with your spine. But it works, and I get a lot more clients coming to me now saying, "My doctor recommended I do Pilates." So it's seems to be, something that even doctors, whether that's a neurospinal surgeon or any category of doctor, maybe it's an orthopedic surgeon, starting to suggest to patients that they should use Pilates as a means of trying to address.
What do you think it is about Pilates versus, say, yoga or just weightlifting that makes it?
Because it deals with the spine. That's and it deals with all the muscles that wrap around the spine. So, everybody goes your core, right?
Right, and
Now,
they just think abdomen,
yeah,
and then they're
it's
good.
like the six pack. That's what they immediately turn their head to. And as I explained to a lot of clients at the studio, I want you to think of yourself as like a Coke can, and you are stuck right in the middle of this Coke can, right? Now, if you look at the cylindrical shape of this Coke can, imagine your muscles exactly like that, wrapping around your spine, right from your neck all the way down to your tailbone. So Pilates is there to really strengthen every single one of those muscles, right? From the front to the back to the side, and to mobilize them as well. So it's not just about strengthening. And, I think once you start to engage in these types of movements, the brain also starts to say, these movements are feeling good for the spine neurologically as well. And I think over time, you just find the body's cooperating with you a little bit more, right? I'm not saying that if you're, for example, somebody who's a tennis player or a golfer, that Pilates is the answer to all of your issues in terms of returning back, because I've had to engage in like heavy strength training, right? So I incorporate a lot of cross training, which is strength training, Pilates, walking, running, hiking, swimming's also another really great option. But I sort of take a very cross-disciplinary approach because I think each type of activity is doing something for my body. And I think, over time that seems to have helped me personally. But if you're somebody who's just like, I just need that one thing to sort of fall back on as a form of movement to help you, I'd say number one, Pilates, and number two, walk. Walk as much as you can, right? You don't have to run, but you need walking to get from point A to point B throughout your life. It's sort of an age resistant activity that, you have to do and you should be able to do. And I think with Pilates, it just brings you back to awareness of habits, how you sleep, how you sit on a chair at a desk, when you sit in your car, sit at the dining table. And those are the habits which are actually getting you into trouble. It's not some freak accident, right? Some people have this freak accident and they have to go for surgery. But most people I know, it's this accumulation, right, of bad habits which have led to that back pain. And then that back pain, your immediate reaction to pain is stop doing anything because it hurts, right? But that actually sometimes makes the problem worse because you stop moving completely and then the muscles really jam up, right?
100%. That's what happened to me. I got hurt in April, and then which led to the herniation in June. And I stopped moving completely in April, and then my surgery was in August, and I didn't start physical therapy until October, so from April to October, I didn't move. And then by the time I started physical therapy, moving was difficult because my muscles would fire in the wrong order. So we had to retrain my brain because I had stopped using everything.
Yeah. I think that's where, I keep saying to people that you need the right support system around you, right? Because what you described is 99% of people, which is the natural reaction of the brain is, I move, this is going to cause me more problems. So you completely stop doing that, right? When actually you've got to reassure the brain that whatever you're doing is not going to hurt you anymore. And so sometimes if you've got somebody who knows what they're doing, who says, let's just gently start to move the spine a little bit right, left, and the nervous system starts to calm down a little bit to go, this isn't hurting. I'll cooperate a little bit more with whatever this person's asking me to do. Well, then you're just reassuring the brain and therefore the body that it's safe to move again. But, how can you be expected to know this if you don't have that support system around you?
That's great. What
Yeah.
is the name of your fitness studio?
So the name is called Chisel and Stride, and I get asked why I called it that in the first place. Um, Chisel, just think of if you take a little hammer and you chisel something, you're sculpting it, right, into whatever you want it to be. And then stride just means to take a step. So I deliberately named it that because they're different forms of strengthening, right, or sculpting. And I didn't want people to think, oh, this is just heavy weights that we're going to lift all the time. Because I use Pilates at the studio and I teach an intermediate level class and a beginner level class. The intermediate level is more with machinery. And the beginning one just focuses on sort of basic techniques and trying to teach you basic Pilates movements. But I also teach a mobility class that's become quite popular. And then on the stride side, I don't expect everybody to want to run or to have to run. So I have a class which just focuses on power walking and hiking, other classes which have power walking, hiking, and a bit of running, other classes which just incorporate running. And then this past 6 months, we've been outdoor hiking, which for me has been really fun because I've seen other parts of the UAE which I previously hadn't got to go and experience. So that's what my studio does in a nutshell.
It's amazing. I'm sure it's very rewarding for you to get people
Yeah.
into physical shape or get them moving again.
It is. We've had all sorts of people come through the studio, but I think what seems to work is that when people feel they're able to relate to you, maybe it's because they're an athlete and I was an athlete, or they had back pain. Well, so do I have back pain, or they're a corporate professional. I was a corporate professional, right? So that relatability factor, I think, helps um, the studio and building a community as well. But for me personally, I can't say I really miss my legal job. I don't miss dealing with stressed out people. I leave people
That's a
in a
whole
much
nother
better mood.
podcast, right?
Yeah. I leave people in a much better mood, an hour later after me, and everyone seems to be in a happy mood. So for me, it's like it just feels half the time I'm not even at work. I just feel like I'm meeting friends and hanging out with them for like an hour.
Yeah, that's great. It's
Yeah.
endorphins versus, cortisol, right? It's cortisol, the stress level.
Yeah, exactly. Exactly, exactly. But it also, I sometimes I do think with the nature of my job, because I'm teaching a lot of classes, it honestly helps my spine because if I were still a lawyer, I promise you, I don't think I would have made progress as quick as I have because that would have involved obviously sitting at my desk a lot. So, I to some extent am grateful for this transition into the fitness world personally. But also, it's good because on that microdiscectomy group, I can see people are stuck and I'll sometimes post, just a few photos here and there to say, look, these sorts of exercises can help you. Or I managed to run 5K, at one go, and people are like, oh my God, after the surgery, you managed to do that. The point is you can get back from it, right? But it's a very sort of methodical approach you need to take to coming back. And either, you know, I've had experience as an athlete, so for me it's a little bit different because I'd been injured before, not in my back, but I had always had some structure in terms of recovering from an injury. But if you don't have that, you have to find a way to get people around you, who you trust and who you feel can understand what you're going through. Because sometimes you just have a bad day, right? It's like your back's really hurting, it's annoying you, and then it just emotionally drives you a bit bonkers as well. So, you know, that person has to be able to understand that. And a few clients of mine, I think they say to me, they're like, you understand this pain, right? And I'm like, yeah, of course I do. I've been through it. So, a lot of people don't, and they'll hypothetically talk. And that's what also drives a lot of back patients crazy because they're like, you don't get it. You don't understand where I'm coming from. When I'm saying it's excruciating, you don't understand how bad it can get. So, yeah, I think it's, you just have to find that team who sort of gets you and who can provide you that structure for you to get better.
Well, Saloni, I just appreciate you so much willing to join me at 10 o'clock at night in Dubai and
No
sharing
worries.
your story. It is definitely an inspiration, and I think it'll be just a great message for people currently feeling stuck that with the right dedication and sticking to a routine, they can get back to feeling better. So thank you.
Absolutely. Thank you.
And if you are a listener and you have a positive story of recovery that you would like to share, head to bedbackbeyond.com and click share your story. I would love to include your voice on the show. Thank you again.